My name is Sandy Howell, and I am the community educator for the Stanislaus County HICAP program. HICAP stands for Health Insurance Council and Advocacy Program. And today, Maria Profeta, our program manager, is also here. So we would like to be able to talk to you today about if you're new to Medicare and what you need to know. So how can HICAP help you? You are now turning 65, and I know you will have a lot of questions, and you're going to need your Medicare, and it's going to look like a card like that, a red, white, and blue card. So who gets Medicare? You're turning 65 or you're disabled, because Medicare is a federal health insurance program for people who are 65 or older, for people who are under 65 with permanent disabilities, or people with end-stage renal disease or ALS, which is also Lou Gehrig's disease. When to first sign up for Medicare? When I'm 65. When you're about to turn 65, if you're receiving a Social Security check, you don't have to do anything. Your Medicare card will automatically come in the mail, and it's very important to look for that card. If you're retiring after 65 and you're not receiving your Social Security check, you will need to enroll in Medicare. You will need to ask how Medicare works with your employer group plan. Remember, there are penalties for not enrolling in Part B or Part D. And you want to compare your employer plan, your retirement plan, to Medicare Advantage plans and the Medigap plans that are also called supplements. Why enrolling on time is so very important. You don't want to face any penalties. Part B, if you don't enroll when you're first eligible, you will be paying a penalty. And if you decide not to get your Part D prescription drug plan, you will also be paying a penalty. Can I make changes later? There is an annual open enrollment period from October 15th to December 7th. This is for when you have a Medicare Advantage plan or prescription drug plan. There's an additional Medicare Advantage open enrollment January 1st to March 31st. There's also special enrollment periods for people who have been diagnosed with chronic health conditions, or if you've had a loss of coverage, if you're moving, or if you have both Medi-Cal and Medicare. What are the parts of Medicare? The ABCs of Medicare. Medicare Part A covers hospital. It's called hospital insurance. It covers you when you're inpatient, or if you need to go to skilled nursing, or if you need hospice care, or maybe some home health care. Medicare Part B is medical insurance. It covers you when you have certain doctor services, outpatient care, medical supplies, and it covers lots of preventive services. Just a special note, Part C is Medicare Advantage and is optional, and we'll explain this later. Medicare Part D is prescription drug coverage. It helps cover the cost of prescription drugs, including many recommended shots or vaccines. And now I would like to introduce Maria Profeta, our HICAP program manager.
Thank you, Sandy. So I'm going to go ahead and discuss with you why Medicare alone is not enough. You need additional coverage to help pay for what Medicare does not cover. Remember, when you have original Medicare, it only pays 80%, so you're responsible for that other 20%. Medicare alone also has annual deductibles for the hospital and for doctor visits. And you remember to need a Part D prescription drug plan. It is often included with a Medicare Advantage plan, but not with Medicare alone. So what does Medicare cost? Most people who have worked 40 quarters do not have to pay a monthly premium for Part A. Almost everyone pays a monthly premium for Part B. That amount can change from year to year. And remember, those with higher income do pay more for that Part B monthly premium. And the Part D prescription drug plans may have an additional premium. Know your options. You have lots of choices. So we're going to cover what Medicare does not cover You can choose Medicare loan, and you have to have that prescription drug plan. And remember, you will pay all of those additional costs yourself. You can have Medicare and a Medicare Advantage plan, a Medigap supplemental plan, which that has to include that Part D plan. You can have an employer plan or a retirement plan. For those that have lower income and assets, you can qualify for Medi-Cal. And for our veterans, you can qualify for TRICARE or CHAMP VA. These are all different choices in Medicare that HICAP can make sure to explain to you. Which is better, a Medicare Advantage or a Medigap plan? There is no one plan that is best for every person. It is a matter of what's most important to you. So what are your priorities? Is it the cost of the plan? Being able to choose what hospital and doctor you want to go to? Or being able to get medical care outside of your service area or out of state? Medicare Advantage plan, also known as the Medicare Part C. Those plans may be more affordable, so they can have no additional premium or very low premiums. Most of them do include that prescription drug coverage, and they can offer additional benefits, such as transportation to and from doctor appointments, basic dental and vision, or even hearing. But remember, they do have that restricted provider network. That means that you will be limited to which doctors or hospitals that you can go to. But you do get covered if you are out of state or out of your service area, but only for emergency visits. Supplemental plans known as Medigaps, those type of plans will give you the freedom to go and see whomever you want. Remember, these plans will help cover those out-of-pocket costs, so that 20% that you're responsible for. They do offer the flexibility of being able to go to any physician or hospital that you want to go to, and they are generally accepted in almost all states. These plans are standardized, so a plan A is a plan A is a plan A, is what we always say. So the benefits will remain the same on the plans, and you do have to purchase that separate prescription drug plan, and these plans all must be purchased through an insurance broker or a private company, such as Mutual of Omaha, AARP, or even Blue Cross Blue Shield, just to name a few. Now remember, these plans may be more expensive, but they do give you that freedom of choosing your medical care the way you want to. Medicare supplements, again, are standardized, but you want to go ahead and shop around because the benefits all remain the same no matter which plan that you choose, but the premiums can change depending on the company that you purchase it from. Now remember, you have to buy that additional Part D plan, which can include an additional monthly premium. And there are special rules when it comes to Medicare supplemental plans. So come to HICAP and they will explain to you all of these different rules when it comes to Medigaps. So help paying for your Medicare cost. There are programs, if your resources and income are low enough, that can help you pay for your prescription drug costs, also known as extra help, or the Medicare Savings Program to help you pay for that Medicare Part B premium. And if your income and assets are low enough, you may qualify for Medi-Cal. That will not only help you pay for your Part B, help you lower your prescription drug costs, but it will also pay your copays when you go to the doctor or the hospital. These are ways that HICAP can help. Remember, HICAP will help you to compare all of the different plan options in our county. They will help you estimate your prescription costs. They can help you apply for those low income programs that we discussed. They can also help you understand how to meet your share costs when it comes to Medi-Cal, or help you with any kind of billing issues, errors, or appeals. Now remember, all of our services are free, and we also have our community educator, Sandy Howell, who will come out and help you learn what Medicare is, how HICAP can help, and also explain Medicare fraud. We also offer counseling on long-term care plans. HICAP is the most reliable source for unbiased Medicare information. Now remember, HICAP doesn't sell insurance. We are here to teach you all about Medicare so that you can make the best informed choice for yourself with all the different options. Call to make an appointment. We do in person, by phone, or even video conferencing. You may call 209-558-4540. We also offer appointments Monday through Friday at our main Modesto office, 3500 Coffee Road, Suite 19, or in Oakdale, Patterson, or Turlock. HICAP puts together a comparison sheet of all of the different Medicare Advantage plans. We have that sheet available for you for download at www.agingservices.info. So remember, call HICAP for any of your Medicare questions or any Medicare needs, or just to find out what changes may be coming with Medicare in the future. Thank you.